In this video, I'm going to share a diabetes diet plan for weight loss. And if you watch the short video until the end, I'll also share with you a resource that can actually reverse your diabetes, and it takes just 24 hours a day to do it. Although a miracle diabetes diet does not exist to cure the disease. Number 1. What is diabetes? Diabetes is a common and prevalent disease that occurs when the blood glucose levels in your blood get too high. In general, blood glucose comes from the food you eat and is the main source of energy for your body to perform routine and necessary tasks. Most of the food that you eat is broken down into glucose by the body, and this glucose is sent through your blood to every part of your body for energy. Many hormones play an important role in converting the food you eat into glucose. One such hormone is called insulin, and this is made by the organ called the pancreas. The insulin hormone is responsible for taking the glucose from your bloodstream and delivering them to each individual cell. Diabetics either do not produce enough insulin due to a malfunctioning circulating through their bloodstream. As a result, the person's blood is flooded with glucose. Do you have type 2 diabetes, or are you at risk for diabetes? Do you have type 1 diabetes or care for someone who does? If so, then you've come to the right place. Contrary to what you've been told, that you need medications for life, it's possible to reverse diabetes naturally. Type 1 diabetes results when, for autoimmune or other rare reasons, the pancreas becomes damaged and fails to produce insulin. This form of diabetes is most often diagnosed in childhood but can occur in adults. In type 2 diabetes, there are defects in both the production of insulin by the pancreas, insulin deficiency, and the use of insulin by the body, insulin resistance. When damage to the pancreas, insulin-producing cells progresses to the point where the pancreas can no longer spontaneously release enough insulin to overcome the body's resistance to it, blood sugar levels rise. Excess glucose in the blood is a problem because it can damage blood vessels. What's more, the body's tissues can't effectively use glucose for energy because too much of it stays in the bloodstream instead of entering the cells. It is important to recognize that high glucose levels are a consequence of an underlying process that has been going on for years before blood sugar becomes high. To explain, early on the road to developing high blood sugar and getting diagnosed with type 2 diabetes, an insulin-resistant person usually has too much insulin in the blood. This is due to the pancreas reacting to the death and/or dysfunction of its insulin-producing beta cells. Essentially, the pancreas realizes that it has two problems: its overall ability to make insulin is getting worse, and the insulin that it is able to make isn't working very well. So, the pancreas cranks out more insulin to flood the body's insulin receptors and overcome the resistance. This works to keep blood sugars normal until so much beta cell function is lost that the pancreas can no longer crank out excess insulin. Other than its implications for blood glucose and the progression of type 2 diabetes, why is it bad to have high insulin levels? Insulin increases the storage of fat and reduces the body's ability to use fat for fuel. This can lead to weight gain, which plays an integral role in the development and worsening of insulin resistance. Left unchecked, you can see how this will lead to a vicious cycle. Insulin resistance leads to high insulin levels, which make it easier to gain weight by accumulating fat, which increases insulin resistance, which leads to high insulin levels, which leads to more weight gain, and so on goes the cycle. The good news is that diet and exercise can help decrease insulin resistance and its associated weight gain, which may help prevent or even reverse diabetes. Gestational diabetes. Gestational diabetes is the third type of diabetes that occurs during pregnancy. It usually presents during the second trimester of pregnancy and resolves itself after the child is born. Up to 10% of all expectant mothers will develop gestational diabetes, many of whom will develop type 2 diabetes later in life. Number 3. Food and diabetes. People with diabetes have difficulty keeping blood sugar levels in a normal range. The blood turns too sweet as glucose levels rise. Sugar in your blood comes from two places: your liver and the food that you eat. You can't do much to control the amount of sugar your liver makes, but you can control the foods you eat. Foods are made up of three broad categories known as macronutrients, major nutrients, carbohydrate, protein, and fat. Many foods are a combination of two or all three macronutrients, but we often group foods according to whether they are mostly carbohydrate, protein, or fat. Carbohydrates and blood sugar. Foods that turn into glucose when they are digested are called carbohydrates, or carbs. When glucose enters the bloodstream, it's called blood glucose, or blood sugar. Carbohydrates. The more carbohydrate is eaten in a meal, the more sugar is absorbed into the bloodstream and the higher the blood sugar will be. Although very few people would agree that sugary foods are good for you, some foods that we think of as healthy, such as fruit, actually have a lot of sugar. And many people don't know those starchy foods, such as bread, rice, pasta, and potatoes, quickly turn to sugar when you digest them. Eating a potato could raise blood sugar as much as eating 9 teaspoons of sugar. However, it can be hard to predict exactly how someone's blood sugar will respond, as this will likely vary based on genetics and baseline insulin sensitivity. Protein-containing foods include eggs, poultry, meat, seafood, and tofu. Although individuals have different responses to these foods, consuming moderate amounts of protein at a meal generally has little effect on blood sugar. Dietary fat has very little effect on blood sugar. However, we seldom eat fat all by itself. Some foods, like cheese, are made up of mostly protein and fat. These foods probably won't raise your blood sugar very much. But other foods, like donuts and French fries, are made up mostly of carbohydrate and fat. Because they're high in carbs, these foods are likely to significantly raise your blood sugar. Number 4. How to lower blood sugar with diet. What happens if you remove foods that raise your blood sugar from your diet? Is there anything good left to eat? We think so. In fact, we have a whole guide on the best foods to control diabetes. But a picture is worth 1,000 words. These are just a few of the delicious foods that don't raise blood sugar. Many people with type 2 diabetes are now choosing a diet based primarily on low-carb foods, and many clinicians are catching on as well. They often notice that starting with the first meal, their blood sugar improves. The need for medications, especially insulin, is usually dramatically reduced. Substantial weight loss and health marker improvements often follow. Finally, people usually feel better and have more energy and alertness. Choosing foods low in carbs is an effective way to help you control your blood sugar and is safe for most people. However, if you are taking medications for your diabetes, you must work with your healthcare provider to adjust your medications when you change your diet, since the need for medications, especially insulin, may be greatly reduced. Number 5. The science of diabetes reversal. In 2019, the American Diabetes Association (ADA) stated that reducing carbohydrate intake was the most effective nutritional strategy for improving blood sugar control in those with diabetes. Research shows that low-carb diets are a safe and effective option for treating type 2 diabetes. A meta-analysis from 2017 found that low-carb diets reduced the need for diabetes medication and also improved certain biomarkers in people with type 2 diabetes. This included reductions in hemoglobin A1c, HbA1c, triglycerides, and blood pressure, and increases in high-density lipoprotein (HDL) cholesterol, sometimes called the good cholesterol. Additionally, in a non-randomized trial from Virta Health, the intervention group of subjects with type 2 diabetes followed a very low-carb diet and received remote monitoring by physicians and health coaches. After 1 year, 94% of those in the low-carb group had reduced or stopped their insulin use. Furthermore, 25% had an HbA1c in the normal range without needing any medications, suggesting their disease was in remission, and an additional 35% did the same with only metformin. At the 2-year mark, a high proportion of subjects continued to demonstrate sustained improvements in glycemic control. This evidence suggests that type 2 diabetes does not have to be a progressive and irreversible disease. It is clearly a treatable disease when an effective lifestyle intervention is used. Normal blood sugar levels and fewer or no medications likely means no progression of the disease, and no progression of complications. People with a diagnosis of type 2 diabetes may be able to live long, healthy lives, with toes, eyesight, and kidneys intact. People don't just have to manage their diabetes as it progresses. Instead, they can often lower their blood sugar to normal levels with diet alone, and may be able to avoid or discontinue most medications and now have hope to regain their health. We hope that the Diabetes Diet Plan for Type 2 Reversal video gives you some useful tips to help. And if you want to see how to reverse your diabetes within 24 hours, click the link in the description right below this video now. Thanks for watching.